You guys, big round of applause for Dr. Batra.
Thanks so much. I could just use that one, right? Thank you so much. That was live. Thank you. All right, thanks. Everyone can hear me okay? Yeah. I appreciate you guys having me here tonight or today, and also want to introduce sort of the infrastructure behind my practice. Miriam and Gabby and Dr. Shagri, who is my associate, they're back there, so if any questions come up that I can't answer, they'll be able to help you out. I've been working with Obesity Help for probably about 10 years, and a while back I wrote some articles for the actual magazine. And, you know, I started taking care of patients with massive weight loss back in around 2002. I did my training in Cleveland at the Cleveland Clinic, and then I went to UCSD Medical Center to do my fellowship training in plastic surgery. And my area of interest has been reconstructing patients after massive weight loss, which I've been doing for about 20 years. And what I'm going to do today is just go through a slideshow of pictures of some of my work over the last 20 years. And things have evolved, but by and large, you'll get a general idea of you know, the kind of work I do, and more importantly, you know, get a idea about what I call this is really a reward surgery. What the weight loss is doing is making you live longer, but a lot of people after massive weight loss still kind of picture themselves as being obese because of all the loose skin and all the reconstruction that's needed, and they have their own functional challenges with skin and rashes and things like that. And I really step in to help that component out. And the trade-off for sometimes some of the incisions and the scars, but what I found in the bariatric population is that most people find it's worth the trade-off, number one. Number two, there's some of the more, what I would call the appreciative patients that I have in my practice. They're not, you know, you know, in plastic surgery, we deal with patients all over the spectrum. Some of them are very high maintenance. But I find the bariatric patients to be very appreciative, and really am thankful to have a practice with this kind of specialty. So let's go ahead. And so that first slide is really my background. I grew up, I was born in India. Thank you. Okay. So I was born in India. Does this have a pointer on it as well? And that's actually the village I was born in. It's called Kanpur. It's a small village in India. And my father immigrated here in 1970. Subsequently, the rest of the family came here in 1972. We settled in Ohio, in Cleveland. I went to medical school in Cleveland, Ohio. I went to undergrad at Ohio State University. So I don't know if any Bucks fans here, but I went to medical school at Case Western Reserve, and then I did some training at the Cleveland Clinic out there. And that picture on the lower right-hand side is I was in the military. I did 2 years of active duty and then 6 years of reserve duty. And that other picture in the lower right-hand corner is of my older brother, who was, if any of you know Indian families, we're either going to be doctors or engineers. So my brother was a physician, and I had, you know, a mentor to follow. I actually went to school to be a writer, and my parents were like, nope, you're not going to do that. So, you know, some 30 years later now, written a couple of books, which are kind of dark. So if you look me up, you'll find they're like, I don't know how to describe them. They're dark books, but they're more medical dystopian books. One's called Animal, which is being made into a movie. So I've gotten back to what I sometimes think it was my passion projects, but plastic surgery has allowed me to make a living and get to where I can do those kinds of things now and not worry about making a living, which my parents always worried about. So typically when I do bariatric reconstruction, I developed this algorithm about 20 years ago, and most people want to tackle the abdomen and the chest wall at the first stage, and the goals for the first stage are get rid of all the loose skin, but also lift up that pubic area. Sometimes when I see patients who've gone to other practitioners to have this procedure, they treat them like regular tummy tuck patients, which I think is a mistake because there's hanging in the pubic area, there's excess skin there. You got to really lift all that as part of the reconstruction of the abdomen, and then of course work on the chest or the breast. So this is a typical patient, 80-pound weight loss. Belly button looks very normal, and I know there are some surgeons that just decide, you know, get rid of the belly button. I think it's something that belongs to you, so I try to preserve it rather than getting rid of it and try to make it look better than we did at the start of the procedure. And I also tighten up the muscles, so you can see she's nice and flat when we're done by fixing all the muscles. Another patient, she had a laparoscopic sleeve gastrectomy, about a 90-pound weight loss. We did her breast lift and the tummy tuck at the same time. You can see the stretch marks that were above her belly button are now down at the lower part of the abdomen. And then people are going to have, you know, a lot of redundant skin that causes rashes and things like that, and getting rid of that extra skin helps. Now, this patient still had sort of that protuberant abdominal wall, and I think some of that's just genetic. I can't take a sort of a certain body and turn it into a curvaceous body. You kind of do what you have based on the patient's anatomy, so I don't like to oversell what I do. I try to be very honest as a surgeon. The last thing I want is an unhappy patient, because, you know, if I'm seeing 70, 80 patients in a day, sometimes our clinics are that busy. The one patient you don't want to see is the one who's going to beat you up because they had certain expectations. You didn't meet them, and then you have to sit there and sweat it out for the next, 20 minutes. So this patient actually flew in from Europe. I know some of you people are here from across the U.S., but we'll get patients internationally also that find us. She had her breast lift and augmentation done along with her tummy tuck. And what you see in this patient is that the tightening of the abdominal muscles is really what's flattened her out. I'm sorry, that went a little fast. Once again, all that loose skin is gone, and if you look at the side profile, the muscles are back where they belong. That's not just a cosmetic improvement. People functionally get rid of lower back pain and discomfort in the lower back when you fix those muscles. That's something that's been sort of underreported. It's something we've done for a long time, is kind of let patients know that, you know, when that muscles are stretched out in the abdomen and everything's kind of pushing forward, it's causing low back strain, and this helps with that as well. She's curvy. She's curvy when I'm done. I'm not trying to change her body per se, but just getting rid of the redundant subcutaneous tissue. Once again, you know, people ask, you know, is lipo appropriate? Probably not once you've had this much weight loss and all you have is skin. And you can see that just removing that skin makes a big difference. Male patients, you know, this guy's in great shape. You wouldn't know it, but, you know, after 110-pound weight loss, we did a body lift on him. With a body lift, the scar goes all around, completely around the body to lift up the buttock area and the thighs and all that at the same time you're doing the tummy tuck. Here's another guy, mainly a tummy tuck operation. I had a patient see me this morning from the East Coast. We talked about all the loose skin on the chest wall. Really, in males, if you're going to do the chest, you're better off having the scar and removing that loose skin than to try to do a lift and tighten things up. And in this guy, you can see I took the nipples, I transplanted them where they belong on the chest, and got rid of that loose skin. The trade-off, once again, are the scars, but, you know, for this fella, it's well worth the trade-off. Another male patient. Do a lot of males, you know, they don't like to talk about their surgeries. A lot of women will collaborate about it, and they'll want to know who the surgeons are. The guys, it's like they want to, they haven't come to terms with it yet, so. This guy still, you know, probably could afford to lose more weight. I did him before the GLPs were out, but, you know, getting rid of about 12 pounds of that tissue helped his exercise stamina, helped him be more active, and he subsequently went ahead and lost another 20 pounds after my procedure. Once again, just loose skin. And you know, what you see is the abdomen looks normal, the incision's hidden nicely, the belly button looks normal. This lady had what's called a fleur-de-lis, so when you have a lot of redundant tissue in the upper abdomen, sometimes it's worth doing what's called a vertical incision or a fleur-de-lis, where you're doing both the vertical and horizontal incisions to get rid of that loose skin. I lifted her breasts at the same time. Her breasts actually, I think the conference didn't want me to start showing boobs and nipples, which is, you know, I get that. I look at them all day, so it's normalized for me. But she's been lifted, but we haven't put implants in her, and she has a nice shape and nice fullness without implants. Most patients, though, after massive weight loss, they're going to have a significant amount of deflation, and sometimes we're, to balance their frame, we're adding implants. And on this one, you can see, well, it's hard to see here, but her pubic area is lifted nicely. We're hiding the pubic area, but it's lifted. You have to trust me on that. So the way I do this, as I mentioned, I try to do it in 6-hour stages, because beyond 6 hours of surgery, you take the risk of getting blood clots and nerve injuries. And my feeling is in 6 hours, I can typically do the abdomen, the breasts, and the arms. So that's a lot of surgery in 6 hours, but I've got a full team. We do this every day. It's safe, and you know, I would say at least half the patients go home after all that surgery. Some of them want to stay overnight, which I completely get for pain control. But on the second stage, sometimes we'll do the back and other things like the arms and thighs. So if you look at this lady, her back looks great. The scars are hardly noticeable. The incisions in the bra line. Same thing here, where you see the scar, it's a little more pink. It'll take a scar a full year to get better. But there's no way to get rid of that skin through things like laser or lipo, so don't waste your money. And it's important, you know, even if, you know, I'm not your surgeon, that you're going to someone who does a lot of bariatric reconstruction, because everybody's out there doing cosmetic surgery. There's this, you know, people promote what's called the American Board of Cosmetic Surgery. There's no such thing as the American Board of Cosmetic Surgery. It's how other specialties got into doing cosmetic surgery, but, you know, in California at least, they don't, you know, they haven't put a stop to it legislatively. But look for a board-certified plastic surgeon. You're probably in good hands. And then make sure they specialize in bariatric reconstruction. So this is a body lift. You can see her buttocks have a nicer shape. And then vertical thigh lifts. These are difficult procedures, not just for you as a patient, but for me as a surgeon. And the reason it's difficult, I'm working sort of, you know, you're in this lithotomy position, and I'm working right, you know, hunched over half the time to try to get everything closed nicely. But the trade-off is you have this vertical scar. It is going to fade. It'll take a year and a half to fade. But I think for a lot of patients, that's an area that a lot of plastic surgeons don't like to do because it's a very difficult operation. But like in this male patient who you saw earlier that I did the mastectomies on, he needed his thighs done as well. You know, so you don't have to be bashful. You're not awake when I'm doing this, so you don't have to worry about how you're on the table. But I'm, you know, working in this kind of a position to get all that thigh tissue out. And you can see She's got a nice thigh lift. Now, there's also a good example of someone who's, her body's kind of like a square, and I can't convert it to a curvaceous body, so I try to be very honest with my patients. Arm lifts, they always look great from the back, but the scar in the front is what bothers people. But I think in the bariatric patient population, when you have so much loose skin, it's worth the trade-off of the scar. So if you can see, her scar it's at the bottom of the arm, it's worth the trade-off. This lady always reminds me, she was 83 when I did her surgery. She was healthier at that age than she was when she was obese. And Miriam was with me at the time. She's been with me 20-some years. And I just remember walking out of the consult room and telling Miriam, I was like, it's a little odd that she doesn't have any tan lines on her. And she goes, oh, yeah, she's a nude sunbather. I was like, okay. So I kind of remember this patient. And the funny thing was, I said to Miriam after that, I was like, I think she's going to need some, help from her husband post-op if we're going to do her arms, her tummy, and her breast. She goes, and I said, you may want to talk to him. She goes, well, no, the guy in the room is her boyfriend. Her husband's not here. I was like, oh, okay. So it kind of woke me up a little bit about, how liberal she had gotten after her weight loss. She decided to bring attention to her arms with a tattoo after. But you can see all the tissue that comes off. And so the facial part, I think, and everybody does things depending on their priorities. After you lose weight, you naturally look older because when you have a heavy face, you actually look younger because you have more fat, and you look more youthful. After you lose weight, you actually look more aged. And these are patients who've lost, weight. And, I tend to do, most patients, when you have weight loss, you age throughout the face. So in this patient and a lot of patients, matter of bringing the brows back up where they belong, rejuvenating the eyes, the face and neck. Same thing here. What I try not to do is, make a patient look like a different person, because I think that's a telltale sign they've had something done. Most patients don't want to look different. They just want to look like a younger version of themselves. They want to, they don't want to look like they've gone through a wind tunnel. They don't want to be pulled so tight. Guys especially don't want people to know they've had facelifts. So you have to, the scars are a little harder to hide, and you don't want to make a guy's facelift the same that you do a women's facelift because you feminize the male face. You guys have seen like Kenny Rogers and some of them, their brows are too high. But you get a tremendous difference. Some people, despite the weight loss, they still have sort of that genetic heavy neck or that oblique neck. We can, make the neck look a lot better. You don't see the scars because they're pretty well hidden for the face and neck. They're inside the ear and then behind the ear. This lady, she's 74. She's probably taken off about 12 to 15 years. This guy, I remember him because he was the manager for Elvis. That, certain people, they remind me of, when I look at their pictures, they remind me of the stories behind them. But he lives in Mexico, and, he's probably taken a good 10 years off his face, but he looks like himself. This guy looks like himself, and he looks menacing the whole time. He was actually my esthetician's dad, I think. So yeah, if you look, he looks like himself, just looks younger because the extra folds in the cheeks are corrected, and most of his issues were around his eyes. So the brow, upper and lower eyelids, face, neck. This guy's actually, he was a pastor in the hospital. Had, his journey with a gastric bypass. The last thing I'm going to touch upon, I know I had a half hour, so I wanted to kind of speed through some of this, is, what I want everyone to understand, plastic surgery isn't, necessarily just what you're seeing on TV. And, there was years ago, there were these shows coming out, and there's still shows out there like, I forget the name of the show, where there's guys in LA are trying to correct people's mistakes and all that. What's that? Botch, yeah. It's funny you said, because I've taken care of a couple of his patients who came to me in San Diego. Because people will go up there, get something done, and then they have a bad outcome, and they're from San Diego, and I've seen and corrected a few of them over the years. But the bottom line is, I want you to understand that plastic surgery is not just this stuff that's marketed on TV, but it's actually probably the most complicated field within the field of surgery. For example, the first transplant was done by a plastic surgeon. The kidney transplant was started by a plastic surgeon. The whole field of tissue transfers, where you take tissue from one part of the body and you plug it into a different part of the body, was plastic surgeons. And so it's got 7 specialties within that specialty. I'm trained as a craniofacial surgeon, plastic surgeon, and a pediatric plastic surgeon. So for example, some of the work I was doing, like this kid's got a fused skull, and there's an operation where we take the skull off, we reshape the skull and put it back into the patient so that the brain can expand normally. Burns, big part of plastic surgery, so I do some of my work overseas. I go to India and South America, and this lady, her kids didn't recognize her because she was so badly disfigured, and in one operation I was able to take the tissue from her tummy, resurface her neck, and release the scars by her eyes so that her cornea wouldn't dry out. This guy, electrical injury, and when I was talking about the microsurgical stuff, this is a famous case. It wasn't done by me. It's a famous case which showed the first time where you can take a part of the body, and if you look in the distant part of the picture, you can see his hand is plugged into his armpit on the other side with the blood vessels from the axillary vessels supplying the blood supply to that hand to keep it alive while the arm healed on the other side, and then that hand was transplanted back. This is a patient who lives in Hemet, and she came through our charitable organization. She's a very risky case. She had gone to University of California, Irvine, and also UCLA, and they had actually turned her down for surgery. She came through our charitable organization, and we took her on, and her big thing was, I don't want to look normal. I just want to be able to see out of my eye. Don't look like a freak, because she wanted to have a job and do things and be out. And so she actually is now a hairdresser in Paris, California, which is by Riverside. And actually, on Oprah's last month of shows, Oprah had invited me and her, because Oprah had read about her story in the LA Times. And so we were on the Oprah show for this. And then sometimes I jump into doing veterinary surgery, because veterinarians are so unaffordable now. I'm just kidding. But my dog had run out into the street, had a broken leg, so I actually helped operate on her. And she's pretty pissed off at me in that picture, because I yelled at her and she ran into the street and got a broken leg. But we put a plate on her, and that's her after she got her plate off, kind of zoned out. And that's an old picture. That's me with my eldest son now. He's 12. But somebody pointed out that it reminded them of that Austin Powers. So I think that's everything, guys. I appreciate your time. And I think some of you are seeing me for consultation. I'm happy to kind of give you a brief overview of what I think you need. I have people that fly in from all over to San Diego. They'll stay for a week. San Diego is, one of the better places to stay if you need to stay somewhere after surgery. And I'm pretty accessible. But all the stuff having to do with pricing and all that, Miriam and Gabby can go over those with you. Dr. Shagri, my associate's also here. You can always pull him to the side and ask him questions about, various procedures. And I appreciate your time. Thanks so much.